So a lot of times what happens in a practice where somebody's going to get a diagnosis of dementia is they get told that diagnosis, but then they don't get a lot of additional information. And that's the moment in which they need the most information. Neurologists, once upon a time, were not well regarded because we were seen as engaging in a practice of diagnose and adios, meaning we would make a diagnosis, we would know what the disease was and why it was happening. We just didn't have anything to offer to make it better. In dementia care, neurology is no longer diagnose and adios. Even for some of the most complicated dementias where we don't have a pill or an infusion that I can write a prescription for, there are still ways that we can help. So diagnose and adios, which still happens these days, all too frequently I fear, gives people the impression that there's nothing that can be done, and nothing could be further from the truth. For Alzheimer's disease, we now do have the earliest and first disease-modifying medications. We have symptom-modifying medications, and we have decades worth of knowledge and experience at helping guide families through a cognitive disease. So we can help you live your best life, your family's best life, even if you have a cognitive disorder. But the thought of cognitive decline is terrifying. I get that. I understand that. It's one reason that I became a dementia neurologist, because I want to help people, and I know that tools exist that will allow me to do that. It's a completely natural thing to want to avoid or run away from a problem like cognitive decline. Get checked out. We can help.